My intuition is telling me there'll be better days.
Hello, good people of YouTube. Welcome to my channel. If you are new, what's up? My name is Natalie and this is my channel, Music to Makeup. If you are returning, hey fam, good to see you again. So, unless you have been subscribed for a minute or you know me in real life, you probably don't know that I am a registered nurse. I work in a cardiovascular intensive care unit, and this video was actually requested by Wendy. Shout out Wendy. Well, I filmed this video a few weeks ago, and a few minutes after I started filming it, the battery in my microphone died, so the entire video there was no sound, and I talked for a long time, like over an hour. I was so pissed, and I was like so pissed that I'm like, I don't even want to do it anymore. But it was requested, and because I hardly ever get requests for videos, if you do request something, I'm most likely gonna do it, unless it's something crazy. But especially if it's about me and getting to know more about me, I'll definitely do it. So I'm gonna be talking about why I became a nurse a little bit, what it's like being a nurse, and then what it's like being a nurse, especially now during COVID-19. So if you are interested in hearing about that, then keep on watching. And if you do like this video, please let me know by giving it a thumbs up. And don't forget to subscribe to my channel before you leave. I know you're probably thinking like, wow, your hair got so long and thick overnight. I know. Okay, so where to begin? Ever since I was very, very young, I knew I wanted to do something in the medical field. I went to a medical magnet high school, and my first year of college I went to University of Florida and I majored in microbiology. The reason I said why I changed my major from microbiology to nursing, because I originally wanted to be a doctor. I wanted to be an anesthesiologist. I said it was because my stepfather passed and I wanted to move closer to home to be with my mom, and I was also engaged at the time, so I wanted to be with my fiance. But like looking back on it now, I remember my mom said something to me in high school, and she was like, are you sure you want to be a doctor? Because only like the top 5% of people become doctors. Mind you, I graduated third in my class. I was in the top 1%. But that comment always stuck with me. And I think, you know, just everything, I was like, you know what? Maybe she's right. Maybe I'm not good enough to be a doctor. And my stepdad was diagnosed with lung cancer my later years in high school, and my first year of college he was in hospice, and you know, I would see the hospice nurse, and like she knew what she was talking about. So that is kind of what made me decide to change my major to nursing. So do I even want to tell this part of the story? I mean, it doesn't really have anything to do with like what's going on now, but let me give you a little history of nursing, my nursing school experience. Nursing school is fucking hard. I'm a very smart person. I don't want to come off sounding pretentious, but I am. I'm a very intelligent person, and nursing school was the hardest thing I've ever done. Twice. So let me explain that. So I went to USF nursing. I was a semester away from graduating, and something happened. I ended up in the hospital for a week, and if you miss a week of school, there's a test every week, and like each test is worth like 20% or some ridiculous percentage of your grade. If you miss one test, you fail. And let me be clear, failing in nursing school is anything less than 80%. So if you get less than an 80%, you fail. And you're only allowed to retake one class if you fail. They also had another rule that if you withdraw from 2 classes, that's considered failing. So while I was in the hospital, I withdrew from one class. I didn't want to withdraw from the second one because I'd already withdrawn from one the previous semester. But anyway, so that ended up being 2, and then because I had missed that test, I ended up failing. So I had 2 withdrawals and a fail. And I was kicked out of the program, semester away from graduating. Even though I had all the documentation proving that I was in the hospital, I even tried to appeal it and everything. They didn't care. They were all about making money and getting my tuition again. So they were like, well, you can reapply. So I reapplied there, and I reapplied to another school. I was accepted to both. So I was like, fuck you to the first school, and went to the other school. And in the grand scheme of things, I mean, I'm kind of glad that happened, because the school I went to was such a better nursing school than USF. I wouldn't be the nurse I am today if I would have graduated from USF. But I was 21 at this point. I'm still trying to figure out how the world works. I thought all nursing schools were the same. I thought all nursing schools were bachelor's degrees. But the school that I ended up going to, it was an associate's program. And it was 4 semesters, whereas the bachelor's program I had been in at USF was 5 semesters, and it was a bachelor's. So I had to go get my associates, and then the bachelor's program was another 5 semesters on top of that. So I had to go through nursing school twice. And it almost didn't happen, actually. My last semester at my second school, my instructor did not like me. I don't know what her issue with me was, but she did not like me. And I rarely stand up for myself, especially back then, and I did. And oh, that just lit the fire under her ass. She went to the dean and said I needed to be referred to, it's called the IPM program. It's basically for like nurses who have drug problems or psych problems, and said that I had too much anxiety. Bitch, it's nursing school. Of course I have a lot of anxiety. And especially when I know my instructor doesn't like me, and you have to, pass meds, do assessments in front of them. Like, I was trying so hard to be perfect. I was so nervous. So I immediately couldn't go back to class until I paid $600 to go take a drug test and talk to a psychiatrist. So I go and I do this, and I told him, everything that had happened. And he was like, have there been any incidences before like this? And I was like, no. And he's like, to be honest, it sounds like she's just a bitch. I'm like, yes, I'm glad you get it. So he said that I could go back to school and that she was to have no contact with me. So because of that, I had to switch to the night program, because I had been on days which she was an instructor on. So, but the instructor I had on nights, he was the best instructor ever. Like, we're still friends to this day. And it's amazing how much of a difference it makes when someone actually believes in you. Like, I wonder if I still have my recommendation letter from him. So at the very end of nursing school, you do what's called management, and it's where you work on a certain floor, and by the end, you're basically supposed to be taking on the full assignment. So I'm writing this letter to offer my highest recommendation for Natalie Gilly. Oh, so I ended up applying where I did my management. For Natalie, concerning employment and entry into your orientation program for new graduate nurses. I was Natalie's clinical instructor during the fall semester of 2012. Natalie consistently delivered the highest quality patient care. She displayed unmatched critical thinking aptitudes way beyond the estimated level for a final semester clinical student, and was recommended for an advanced preceptor during her final nursing course at St. Petersburg College. She is also very kind, gentle, compassionate, careful, and professional at all times. Natalie was a natural leader on the floor and a positive influence in the clinical group. She was enthusiastic, attentive, always eager to learn, displayed great ingenuity, and was an active team player. Without question, Natalie demonstrates exceptional nursing potential and would make an admirable addition to your healthcare team. Oh, I love you, Mark. He was gay, but I still love him as a person. Finally, get through nursing school. And let me tell you something. Nursing school doesn't teach you shit. It teaches you the science of nursing. And even though you do clinicals while in nursing school, it's completely different than when you're on your own. There are just things that you can only learn through experience. And I think something that all nurses feel at first is, number one, we're scared shitless. And we don't trust ourselves at first because we have no experience. In my experience, it took about 2 years before I felt comfortable like trusting myself and my judgment. And now it's just like I have this like sixth sense, like I know when my patient's gonna crash, like, you know what I'm saying? It's just there are things that come with time. So the majority of my nursing career, I have done critical care. About half of it I've done in cardiac critical care. The other half was in medical critical care, which is basically everything else besides cardiac. And so yeah, now I'm working in a cardiovascular ICU. After I was a nurse for a year, one night, so in critical care, the majority of patients are like intubated on a ventilator. So they have this huge tube down their throat with the ventilator breathing for them. And because of that, they're gonna be sedated and restrained, because your first instinct, if you were to be awake, is to pull the tube out, but that's what's breathing for them. So because most of my patients are sedated, we have to do total care for them. We have to turn them every 2 hours. We have to bathe them. I never thought that learning how to change a bed with a person still in it would be a skill that I would have, but I do. And so one night I just got done giving my patient a bath, and me and the tech, went to boost them up in bed, and I heard something in my back pop. And I went home, and I remember dreaming that I was in excruciating pain, and I woke up, and I was in excruciating pain. And I knew I had done something intensely serious to my back. I knew there was something tremendously wrong. And my first mistake was trying to go through workers' comp. That's just the most corrupt system that ever fucking existed. But I ended up having to have surgery, and if you guys don't know, I struggle with chronic pain every day. I have a little bit of resentment towards nursing because of that. And another thing in critical care, because these patients, are sedated, and, we'll always kind of joke around, like when they're able to walk and talk, like it's time for them to leave the ICU. So because of that, like these patients don't know what we've done for them. We don't get told, that we're appreciated very often. And a lot of these patients, if you think about it, the people that are in the hospital most are the people who are non-compliant with their medications or their diet or whatever it may be. And it's very frustrating when you're trying to help someone who doesn't want to help themselves. And okay, but that's a whole nother story. Another thing I didn't really consider, we make the decisions about what we want to do for our careers when we're so young. I never considered what the hours would be like. And 12-hour shifts, they're hard. The night shift is raw. But I don't think I could ever do day shift. Night shift just fits my personality so much better. I have more autonomy. There's less people. As you guys know, I'm an introvert, so the more people that are around me, the more my energy gets drained. So night shift definitely fits me, but it's rough. Like, my life literally consists of working, sleeping, and filming YouTube videos. And I'm just tired all the time. And it's not something you really think about when you decide to go in a profession. I went into nursing because I wanted to help people. Okay, but let's talk about coronavirus and COVID-19 and what it's been like for me as a nurse. So I remember one morning, a few people came into our unit and started talking about it and said, okay, if this comes here, if it still hadn't hit, you know, that we have some, you know, precautions in place, and this unit is where those patients will be, and et cetera, et cetera, et cetera. And literally the next day that I went to work, I was floated to the COVID-19 unit. And it was insane because I was like, oh my God, this is real. Like, literally yesterday it was a hypothetical, and now it's real. And it was scary because we're usually the ones that have the answers and know exactly what to do. But with this, like, we didn't really know anything about it. And we're still learning about it. And it took a while for things to get, you know, somewhat organized. Just because this is something we've never dealt with before. Oh my God, I have to take this off. Whose idea was it to wear this jacket? Oh yeah, it was mine. Oh, sorry, I've worked the past 2 nights, speaking of, so I'm freaking tired right now. What I thought before this happened, that if anything, we were going to be a lot busier than usual because of, you know, the additional influx of COVID-19 patients. I did not expect, or didn't know that they were going to be, you know, stopping all surgeries, all that. And a large part of the population of patients on the unit I work in are surgical patients. And because of that, the patients on my regular unit were very minimal. And like, my unit's actually closed right now. So we were being floated to the COVID-19 unit, and still are being quite frequently. So you go into this unit, and if you are going to be a nurse having direct patient contact, all of the people on that unit for the night have to take off their regular scrubs and put on surgical scrubs. And then if you're having direct patient contact, you cannot leave that unit for your entire shift. And we're having a runner, which is someone who does not have patient contact and who can go freely throughout the hospital, get any supplies we may need, etc. And the lack of personal protective equipment is real. And that includes masks, gowns, all that good stuff. So these masks, they're called N95 masks, and they are typically what we would use for a patient who either had tuberculosis or was suspected of having tuberculosis. Like, I think I've only, in my entire nursing career, taken care of maybe like 2 patients who possibly they thought could possibly have tuberculosis, and actually used that mask. And now, not only are we using them, and we used to wear it once, you go in the room, throw it out. We're having to not only wear one mask the entire shift, but multiple shifts. We have to save them in a bag and wear them again, because is such a lack of supply. It's bizarre. It is bizarre. And everything that we used to do had to be entirely changed because of this. Like, typically, there was one night where I wasn't on the unit with the patients who had tested positive. I was on the unit where patients were under investigation for it. And I had a patient come up extremely, extremely sick. And he had already coded code blue, which means their heart had stopped 3 times in the ER, and came up to me, coded again. Typically, we would bring the code cart into the room and follow ACLS protocol, compressions, meds, shock, etc. But now we can't bring the code cart into the room, and there can only be total of 5 people in there. So, I would actually thought that the code that I was a part of went really well, but I heard some stories about some that it did not go quite so well. And another thing is, I rarely watch the news because I think it just invokes fear, unnecessary fear. I also think it's important to keep yourself informed, but I just can't watch it because I'm an empath. So all those negative feelings and that fear I will absorb and take on, and that is not what I need. So, but the news was saying that the people who are most affected by this are the older population, and while the older population may be the ones that are most likely to die from this, that's not the demographic of patients we're seeing. The patients that we're seeing that are positive with this and who are sick and in the hospital are like 40s, 50s, 60s. There was a patient that we had for weeks who was 35. She was a year older than me. She was intubated for like 3 weeks. She finally got released the other day. They did like a clap out. It was awesome. But her father was a doctor, which is how he got sick. He had it as well. Anyways, our units are slowly getting fuller and fuller, and they're having to open more units. And now that surgeries are starting up again, I just don't know how that's going to go. And places are opening again. So before, they didn't have enough tests to test everyone, and they wouldn't test you unless you had been in contact with someone who had been confirmed positive without wearing PPE. And I've been in contact with plenty of people who were confirmed positive, but I had my PPE on. But now they're doing mandatory testing for all employees, and there's a lot of us who think we're going to test positive. I have a feeling I might. There was a time where I was displaying symptoms, and I used my PTO and stayed out of work and quarantined myself. Fortunately, if you do test positive, so you have to be like quarantined for 10 days, I think, and the hospital system that I work for will pay us our base rate if that does happen. Because clearly, if we are positive, it's from exposure to a patient we were taking care of. Another thing about this virus is it's not something that if you're exposed to it once, you have an immunity to. You can continue to get sick over and over and over again. So every time I go into that patient's room, there's the possibility that I can get it again and get sick again. I never in a million years thought anything like this would be happening, but it is. It's our reality now. Like when we draw labs for our patients, they have to be double bagged. We're not allowed to send them through the tube station. The runner has to double bag it and physically walk it down to the lab. All of the rooms have to be negative pressure, just like if it were a tuberculosis patient. It's just a really scary time right now, especially for nurses and everyone in the healthcare industry, not just healthcare profession, everywhere. But like, I'm in the front lines. I'm literally feet away from it, and it's definitely scary. We don't get paid enough for this shit. But so the company that I'm working for right now, they're making us take a week of our PTO off within the next couple of months, and that's because they want us to basically take a vacation because of how stressful all this is. Unfortunately, I don't have any PTO left because I used it all, so I'm gonna have to go negative. It's just crazy times right now. If you guys have any questions for me about COVID-19 or anything that I'm experiencing right now, feel free to ask me in the comments below. And yeah, I just wanted to talk about this a little bit. Like I said, it was requested, and just kind of give you guys some insight on what my experience with it has been as a nurse. Alright guys, I hope you enjoyed this video, and we'll see you next time. Mama said I should reconsider law school. That means I wear a suit and bend the truth and feel awful. Hell nah, gotta agree with what that cost you. You make a good salary just to pay Sally Mae. That's real as ever. Ducking bill collectors like Jehovah's Witness when they show up at your door at Christmas. Was broke the best for you both. An older version of me, is she perverted like me? Will she go down on you in a theater? Does she speak eloquently? And will she have your baby? I'm sure she make a really excellent mother. Doesn't know what you gave her a name, was a name, never make it up for you to be open wide. No. And every time you speak the name, does she know how you told me you hold me until you died, till you died? But you're still alive, and I'm here to remind you of the mess you left when you went away.